I want to welcome everyone. We have faculty, staff, students, graduate students, undergraduate students, and alums here with us today. For those of you who don't know me, my name is Meghan Doran, and I'm the director of the Stephen D. London Center for Community Engagement and Social Justice here at Simmons. Some alums who may have known us as the Scott Ross Center or Simmons Community Engagement. But part of our commitment to social justice is understanding that the university does not exist in a vacuum. We're situated in a city, a state, a nation, and a world. To contribute to that world it is rooted in our university's core values. And that means learning and working together around the most pressing issues we face as a society. And one of those issues is certainly housing insecurity and homelessness, which has reached crisis conditions in Boston and beyond. So together with our fellow Gary Bailey, who will be moderating tonight's panel, we developed and launched this Leadership in Social Justice series this spring around this theme. So tonight's panel marks the official launch of a series of events that the university community invites our university community to engage with others beyond our walls to understand more about this crisis and think together how we can play a role in addressing it. I'm really excited to be in a learning space with all of you and to hear tonight from some experts and practitioners doing the work on the ground in Boston. So without further ado, I'm going to turn it over to Gary to introduce our panel.
Great. Thank you, Meghan. And it's been such a pleasure to work with you, and also the opportunity to celebrate the legacy of Steve London, who would be someone who would be so engaged and in the trenches around this issue. And I believe his daughter, Jessica London, is on this call today, on this webinar. So Jessica, this is for your dad and all of his energy that goes into this important work. So thanks to all of you for joining us. And so what we had wanted to do this evening is to have a conversation about when I approached Meghan with this idea, I said that for me, this was the most existential threat of the modern era is the issues around lack of access to affordable housing, lack of access to housing in general, lack of access to the opportunity to be housed, and the ability for all of us to do something. That each one of us has an opportunity to get in where we can and when we can to try to respond to this issue, and particularly as we approach an election year, to make sure that this issue is more than labeling people with labels that are meant to isolate rather than to bring people into our society as equal partners. So that we want us as an institution, as a university, to really make sure that the unhoused, the homeless, and we'll talk about what language is correct, really are seen as individuals who are deserving of access to housing, safe housing, affordable housing, et cetera, and not that they're seen as someone who is to be blamed for not having access to that. So no blaming the victim. So we wanted to move that out of the way. What we have here are 4 individuals who are working in different areas, and I'm going to briefly introduce them, and then we're going to move into a conversation. We're delighted to have Luke Schuster, who is the executive director of Boston Indicators, which is housed at and works with the Boston Foundation. And Luke Schuster does a lot of important work in really assessing and looking at policy and helping to provide the data that influences policy. And the Boston Foundation and Boston Indicators has been focusing in this area for a while now. And they recently released a report that we'll hear a little bit about in terms of some of the issues affecting people in the Commonwealth. And so this is not focused just on Boston, it's focused on Massachusetts, the Commonwealth, the region, but it's important to be able to have this kind of data. So welcome, Luke. I'd like to also welcome Connor Schoen, who is the co-founder and executive director of Breaktime. Breaktime is well, let me say about Connor. Connor is one of those folks that I really appreciate getting to know in terms of someone who sees an issue, gets involved in it, and then develops a response that leads to larger systems change. So when he was a student at Harvard, he understood the needs of LGBT youth, particularly who are disproportionately affected by homelessness. And he created and was doing some work in the community, and after graduating created Breaktime, which has now become, I think, one of the most important agencies in the city that is responding to the needs of LGBT youth particularly, but youth in general. So Connor, welcome. We're glad to have you here as well. I'd also like to welcome home Simmons alumna, Dr. Joanna Rorie, who is a proud Simmons alumna, an advisor to Simmons Dotson's program, which helps to prepare that next generation of nurses, focused particularly on supporting nurses of color. Dr. Rorie is as a friend, as a colleague, as a doula, has been very involved in midwifery, has also been very committed to working with pregnant and parenting homeless women in the city of Boston, and has created the Neighborhood Birth Center as a way of creating safe space for women who are underhoused or have no housing, but who are pregnant and going to deliver a child. And so the importance of creating a system that responds to those needs. So we're delighted to have you with us, Joanna, as well. And then last but not least, we have Kelly Turley, who is with us, who is the Associate Director of the Massachusetts Coalition on the Homeless. She is a BC social worker. We will hold that against her. She has taken lots of classes with our esteemed colleague, Dr. Hugo Camia, who is beloved here at Simmons. So we know that she's got the right vibe and the right commitment. And she's doing such important work and the larger systems of dealing with this issue across the Commonwealth. And so we are delighted to have everybody here. I'm Gary Bailey, the MSW Program Director here at Simmons University, a professor of practice, both at our School of Social Work and our School of Nursing and Health Science. And this issue is important to me, and I'm going to ask all of you to talk about why this issue is important to you. And why you chose to give up part of your evening to join in this conversation. But it's important to me because I walk along it where I live in the South End, and it's impossible not to see the numbers of people who are sleeping in doorways, who are when you go to the T station every morning, sleeping out. I saw someone the other day as it's raining in Cambridge and Harvard Square, under their blankets, not under cover, in the rain. And so that reality of walking around, I've begun looking under bridges and seeing encampments to make sure that I at least acknowledge that I'm seeing what I'm seeing and watching the ways in which people are really the effort they're putting in to hold on to their humanity is sometimes overwhelming, but something that is important for us to see and not to walk by, and that we're not looking at things that are just about people who are on drugs or mental illness, et cetera. To really listen to the stories of individuals has really become part of my concerns. I'd be interested, Kelly, what brought you to this work?
Yeah, thank you, Gary. Thank you, everyone. I've been at the Coalition for just over 20 years. Started working at the Coalition right after finishing social work school, but before graduate school, I had spent some time working with people experiencing housing instability and homelessness in Philadelphia, and was really motivated by this sense that housing and access to resources are human rights. And so how can we work to change that equation, seeing in places like Philadelphia and Boston, but all across the country, that we're not honoring that right to housing. And so how can we use our access, our privilege, our educations, our resources to help change that narrative, to connect with people who are experiencing housing instability and homelessness, and to make those systemic changes. And so I've been grateful to be able to work at the Coalition, where we are working directly with individuals and families, but also pressure campaigns at the State House and beyond to be able to address the root causes.
So can you say a little bit about the coalition, and coalition means what in terms of, is it an amalgamation of other actions, activities? Greater Boston Interfaith Organization is a coalition who's working on housing as well. What is the Massachusetts Coalition? Can you talk to people about it a little bit?
Sure. So the Massachusetts Coalition for the Homeless was started in 1981. It was started originally as more of a true coalition, pulling together providers and advocates who were seeing a dramatic rise in the number of families and individuals experiencing homelessness. And that was at a time when there were a few shelters for unaccompanied adults experiencing homelessness, but really there wasn't a statewide response for families and children experiencing homelessness. And so the first main campaign that the coalition worked on, definitely before my time, was to establish the right to shelter for families with children here in the Commonwealth. But that work has evolved over the years. And so we do operate as an independent nonprofit, but working in close collaboration with allied organizations all across the state, including groups that are working on that provide shelter, that provide long-term housing, that are in the healthcare sector, that provide mental health resources, faith-based communities, a wide range of organizations, as well as people with lived experience of housing instability and homelessness, and with a focus on, what are the systemic issues that perpetuate housing instability and homelessness, and how can we really get to honor some of the commitments that the Commonwealth has made to address homelessness and to make sure that we're not continuing to see wide-scale housing instability and homelessness.
I hope we have some time to talk about the way in which the Commonwealth of Massachusetts, when this was less complex, made a commitment to providing housing, but when it gets complicated, are in some ways stepping away from or backing up from that commitment. So it's important when we think about these policy decisions to think about what it looks like when we're doing them in so-called less pressured or good times. And so how do we build policies that are reflective of what the world will look like, not what it is? So thank you for that. Luke Schuster, can you talk a little bit about Boston Indicators and how you came to this topic and your work at TBF?
Yeah, thanks, Gary. Well, you provided a good intro for me, so I won't restate all of it. But Boston Indicators is an action-oriented research center housed at the Boston Foundation. Being housed at the Community Foundation for Greater Boston, we're in a nice position to connect with advocates in working on the ground on the issues that we're doing research on, to always try and make sure that the research questions we're asking, the policy solutions we're exploring, are relevant to real world efforts to improve the region rather, and advance equity over the long term. Boston Indicators does a really broad range of research. We've done a lot on demographic change, on economic inequality, and increasingly the last 4 or 5 years, we've done more and more on housing, and driven, pretty directly by the fact that we have a growing and persistent housing crisis that's, squeezing families of all income levels, but, obviously creates the most acute challenges and crises for the lowest income families among us, for new arrivals, folks seeking asylum and refuge from persecution and hardship elsewhere in the world. And so that's what's brought us to housing in particular. Maybe through the conversation, I can speak more to some of the specific research projects we've done, but in particular, for 2 years now in a row, we've done the Greater Boston Housing Report Card, which is an annual deep dive into what the trends look like. And I'll just highlight quickly, things that won't be surprising to anyone, but important to just remember the long-term structural sort of backdrop to some of the challenges we face as a region, is that our inability to build enough housing at a range of different cost points for all the folks who want to live here has led to a dramatic housing shortage. Anybody on the Zoom who's looked for, an apartment to rent in recent years will know there's just very few units on the market at all. And then those that are very expensive. And so that's led to an increasing affordability crisis that shows up in a bunch of ways. A really common measure we look at for housing affordability is, are you able to spend less than 30% of your income on housing costs? And the number of folks who can do that has gone down and down in recent years. We've also seen really large increases in people living in overcrowded housing. The measure we use for that is housing units where there are more people living in that unit than there are rooms, and that's increased really significantly across the region over the last year. And all of this is, one of the key backdrops for why, as a region, we have higher rates of homelessness in Greater Boston. So I'll just end by saying we haven't done a lot really specifically on homelessness. We've included some indicators, some measures of homelessness in the report card over the past 2 years. But because we haven't gone deeper and it's a growing challenge for the region, we're just beginning a new research project where we're going to go deeper for the first time. Hope to release that this fall. So I'm eager in this conversation both to share some very early thoughts from that research, but also to gain insights and thoughts through the conversation that'll help shape that project.
Right. Thank you, Luke. We're delighted that you're here. And the important work, the intersectional nature of the work that you've been doing, I got involved with Boston Indicators through the work you were doing around education. And those meetings were, I thought, some of the most dynamic, interesting meetings, and then really thinking about wealth and access to resources, and they're all interconnected, clearly. And so the scaffolding is important. And it's going to be important for our audience to understand why research matters. Research and evaluation really matter, and sometimes that's a hard connect for people to make. Joanna, can you talk about your work and how you came to be involved and so focused in this particular area?
Sure. Thanks, Gary. I started actually in Washington, D.C. as a National Health Service Corps scholar. And I was assigned to D.C. General Hospital, which actually doesn't exist anymore. But the population that was coming in for prenatal care at D.C. General Hospital were homeless, low-income women. And so I began to think about what this meant in terms of outcomes for pregnant and postpartum women who were seeking prenatal care, and more specifically seeking be able to
And you're frozen.
live
Yeah, you're frozen.
that care using the okay.
Yeah, there you are.
Should I do?
No, keep going.
Oh, okay. Okay. Came back to Boston and started the nurse midwifery service at Beth Israel Deaconess Medical Center, and that hospital, Demick Community Health Center, and was their first director of OBGYN services. We started the Neil
And try turning your
House, which was a program for homeless women.
Kind of turn your camera off. It might allow the feed to work a little bit better.
Am I okay now?
Yeah, but turn your
camera. Okay?
Yeah, turn your
camera.
Yeah, turn your camera off. Okay, and let's see if that helps with the bandwidth.
Can you hear me?
Yes. Yep.
Okay. Okay. So was at Demick for 23 years, working on a variety of programs for more specifically for women who were substance abusing during pregnancy. And if they were substance abusing, most likely they were homeless. And then from there, worked with Rosanna Means in the program Healthcare Without Walls, the Bridges to Moms program, which specifically was a program for homeless, pregnant, and postpartum women. In the meantime, I have been working for the last 10 years on launching a neighborhood birth center that will give women who are not high risk, but low risk women, an option in terms of where they want to have their birthing experience. And I continue to do postpartum care at Boston Medical Center. I'm the postpartum rounder, where I've been working with trying to get women placed after they have had their baby. Many women are couch surfing during the pregnancy, which means that that's unstable housing. That's housing insecurity. Many of them cannot return to the place where they have been staying because, like Luke had said, it's overcrowded. They're staying on a couch, or they're staying in a small room with a curtain over the door their pregnancy, and some of them already have 2 or 3 children who are sharing those accommodations with them. And so my job is to work
So Joanna, you're breaking.
with
Okay, we'll come back because you're breaking up, but we've got a good picture of the work that you're doing. I'm going to have Connor talk about his work and his entree into this topic. Connor?
Thank you, Gary. It's great to be here, and thank you everyone who's joined. Can you hear me okay?
Yep.
Okay, great. So I started Breaktime back in 2018. As Gary mentioned, I was a student at Harvard at the time and was actually in my own process of coming out when I learned that 40% of young people ages 18 to 24 experiencing homelessness are LGBTQ plus. And so, well, the shelter I worked at, Y2Y, was one of the first places I came out. It was a space I found so much acceptance. So ever since, I've been tirelessly committed to ensuring that every single young person has access to the opportunities and support that they need to reach their full potential. And that's what Breaktime's all about. Very briefly, I'll just share that what we do is we equip young adults experiencing housing insecurity with the jobs and the financial security that they need to obtain and maintain housing security for the long term. We work in partnership with housing programs. We don't provide housing or shelter, but we work in partnership with those programs to provide the job and financial counterpart, if that makes sense. So we get folks who are staying at a shelter like Y2Y or in a housing program. Through a 3-part program, we train them up, get them into the workforce, and help them to establish a significant level of savings, a prime credit score, and a steady life-sustaining amount of income that's going to help them to sustain housing for the long term. We are evolving constantly. We're only 6 years in and have some big goals for 2030 for the next 6 years. But really our mission at the end of the day is to do whatever it takes to break the cycle of young adult homelessness specifically.
Great, great. Thank you. And you have Quenisha Boykins, who is your clinical director, and it's a placement site for social work interns. And so it's really, it's amazing to watch the growth in the organization. So bravo, and you're doing such important work. All of you are doing really important work. Luke, can you talk a little bit about, you started talking about, what are some of the systemic issues contributing to housing insecurity? You began touching on that, and how can they be addressed? What can we do about some of these issues?
Yeah, so as I noted, our research has focused so much on housing and the housing market broadly. So that's where my attention immediately goes. It seems really clear that at a kind of macro level, the reason why a region like Greater Boston has higher rates of homelessness than most other metro regions in the United States is not because we have higher rates of mental health issues or higher rates of substance use disorder or higher rates of poverty. In fact, we have lower rates of poverty compared to most other US metro areas. The reason why is we haven't built enough low-cost housing to meet the needs of people. And so you can be a person struggling with some of the very real challenges that, you know, befall all sorts of families and have relatively low income. But if you're in, you know, a state like Mississippi or parts of Texas, or, you know, a lot of other lower cost areas in the country, at least you can find shelter still because there are low cost options available to you. And that's just not the case in Greater Boston. One interesting finding from some recent data on homelessness that I thought I'd share here is there was new point in time counts of people experiencing homelessness nationwide that was released for 2022 a few weeks ago. And Brookings has a nice interactive table where you can just sort the data by major cities to do some comparisons. And that most recent data has mostly really bad news for us in Greater Boston, except paired with one piece of, I think, meaningful good news. So the bad news is we have the second highest rate of homelessness among major US cities as of 2022.
Wow.
The good news, though, is you can sort that data by sheltered homeless versus unsheltered homeless. And if you look just at unsheltered homelessness, we actually have the 8th lowest unsheltered homelessness rate, which means that a much greater share of people experiencing homelessness in our region are at least receiving some shelter and some supports. And I think that speaks to the great work that other folks on this panel are doing, that the network of providers in Greater Boston have done, really directly for families. Some folks probably know Massachusetts is the only state that has a legal right to shelter for families. And so we are, you know, guaranteeing to a certain degree some provision to support families experiencing homelessness. That right to shelter does not exist for individuals in Massachusetts. So there's an important distinction there. So anyhow, what I make of all that, and again, I'm looking at a very high level. I think there's going to be other important contributions from others on this webinar. But we have a real shortage of accessible, affordable housing that over the long term has led far more families and individuals to experience homelessness in our region. But we are doing a better job in the US context of at least providing shelter for many of the families. So you know, where that points me for sort of strategies moving forward is making sure we're also doing enough to support individuals experiencing homelessness. And ultimately, the far better approach would be to not have people fall to the social safety net of needing shelter provided by all these important providers, but to have a housing market that really works for everybody in the first place.
It's going to be really interesting. We have a question that aligns with what you just identified about incentives. How do we incentivize affordable housing being built? You know, it is, you can turn around and touch multi-million-dollar condos all over the city. My neighborhood is, we're going through the 3rd wave, I'd say the 4th wave of gentrification in the South End now, and it gets harder and harder to find a place that even people with a certain level of means can afford. You know, it's interesting the conversations I'm hearing of people talking about there, you know, even within people with access to resources, that reaches a point where they can't afford to touch the next big thing. So how do we incentivize affordable housing being built?
I'll share a couple quick thoughts, and this isn't going to be a comprehensive answer, but one is, again, on the broader housing dynamics. We focus so much, understandably, on homelessness in the urban core of the region because that's where it manifests and it's visible to people. But I think one of the big reasons we've gotten to the place we have is because we've allowed suburban municipalities to erect zoning rules that literally make it illegal to build low-cost housing. I mean, a lot of the higher income suburbs west of the city that actually have good transit access along the commuter rail and could access jobs throughout the region have set up rules that just say on any given land, the only type of housing you can build is a large single family home on a large plot of land. And so your question framed it as incentives, which I think there are things we can do on the incentive side, but almost as a first order thing, I think need to remember that a key strategy needs to be taking away the legal barriers to building low-cost housing in the first place. And so the suburbs are sort of let off the hook in this conversation so much because they have erected such a regulatory kind of wall from ever being a part of the conversation at all that I think is really problematic long-term for us as a region.
I mean, that's very interesting. And I'd be interested, Kelly, in hearing your thoughts on this as we are looking at, the governor has been talking about building the requirement to build housing near transportation and having that kind of access. But if you don't understand zoning and the ways in which zoning is a new kind of redlining, or, you know, it's the way in which you redline a neighborhood and make sure that you can control who has access to it. Is this a problem that you're seeing across the state in terms of access to care and a contributor to homelessness statewide?
Yeah, absolutely. We're seeing the issues around zoning play out, as Luke said, in suburban communities all across the state. And, the legislature and the governor have tried to intervene to create some carrots, some sticks to encourage communities and to create a right by right that they're that within municipalities that previously had single family zoning only to allow for multifamily zoning. And then that's going to be a real game changer, but there's many more zoning reforms that need to go through beyond the communities that are touched by the MBTA, which is where some of those zoning changes have already gone into effect. But that, there's a lot of focus and resentment in communities that have a lot of housing that's affordable to lowest income families and individuals, or that are hosting shelters, to make sure that it really is a Commonwealth-wide problem and that communities across the state are doing their part. And so we've seen that play out in terms of where some of the overflow shelters are being cited right now that the state has capped how many families can be in the traditional family shelter system. And, the governor and others point out, well, 90 communities are hosting shelters right now across the Commonwealth, but there's 351 cities and towns. And so thinking about how can we make sure that not only is every community contributing positively, but that families and individuals who are experiencing housing instability and homelessness don't have to be uprooted from their home community in order to access resources. So they don't have to come to Boston, Worcester, Springfield, or other hubs where a lot of the resources currently exist.
It's interesting. When I was a graduate student years ago, my first student placement was at an organization called Travelers Aid, and Travelers Aid had we would go. I didn't want to do this placement, but every Friday night I'd have to go and be in the bus station, the old Greyhound bus station on St. James Street, and this whole area looked very different 40 years ago than it does now. And what people were doing in Boston was part of that. We were moving homeless people around the country. You'd get a bus ticket and a few bucks, and we'd put you on a bus and send you to another city. And that was the way in which people were managing homelessness. And people would arrive at the Greyhound bus station with no plan, no place to live, and you'd meet them and you'd help them get situated. But there were SROs, there were places, there was the old Y, there were places where you could at least shelter people for the short run until you got them settled for the long run. And looking at that system now and looking at what's disappeared from it, which is the affordable options. I look at Beacon Hill now. The Cambridge side of Beacon Hill was all SROs back in the day. The Beacon Street side was the Glory side, but you had SROs, and that's disappeared, that piece of infrastructure. So I'm wondering, Kelly, when you're doing the work around the state, what are some of the coalitions, the collaborations that we need to make happen so that we're able to not recreate that old model of an SRO? I don't think we'll go back to that, though Denver's doing, some cities are doing things that seem similar to me. But what are some of the options?
Yeah, I think, in Massachusetts, we really need to maintain a large menu of resources so that we know that people who are experiencing housing instability and homelessness have their own personal experiences and needs. And so making sure that we have options that meet those needs. And so for some people, it may mean that they need a long-term housing subsidy, but other people may need something that's more flexible, a bridge subsidy. So maybe there's, their situation may change in a year or two, and they don't need to be locked into a long-term, for example, a federal Section 8 voucher or a voucher through the Massachusetts rental voucher program. And making sure that the resources are there at the state level, but that we're maximizing resources coming down from the federal government, and in some cases combining resources. So there's like for-profit developers that are doing some work, but partnering with nonprofits to provide the services and the wraparound supports. Maybe it's a housing unit that has federal tax credits, but that it also needs to be combined with a state-funded subsidy to actually reach the lowest income families and individuals. Because right now, the housing market is obviously in crisis, and we're not sustaining, we don't have the resources available. And that for the lowest income families and individuals, developers are saying, like, we need more money. The math doesn't work for us. And so we need to make sure that the federal government, the state government, and nonprofits are also, being part of that solution. And so I think, in Massachusetts, we're lucky that the state has historically funded state-funded public housing in addition to federally funded public housing units. There's a housing subsidy program targeted to individuals with disabilities, to older adults. There's subsidies for families with children, but they're not to scale. So I think that that's really where the question is that we have a lot of the models. We know what to do. We need to bring the programs to scale and have that political will to do that. And right now, as the state is looking at a decrease in revenues over what their projections are, that there's discussions, well, what are we going to cut? But that these areas supporting people experiencing housing instability and homelessness, trying to make the case that this can't be where we balance the budget.
Right. Yeah, we cut people's taxes, so that the decision was made to cut taxes, which we could go into and have a really involved conversation about that decision, and then a commitment not to go back on that in any way when we have hit the wall and really need those resources. Joanna, I know that you spent so much time when you were trying to get the birthing center developed and looking at population, working with state legislators and others trying to find this money. When you think about the lack of access to, we're a healthcare rich city, yet there are more people poorly served anyway, I just heard a data point the other day that says it costs more to deliver healthcare, and there are people with poor outcomes within that nexus, so that there's a lot of expense and poor returns, particularly for poor people. What do you see as being an intervention through your public health lens? What needs to happen for this population so that they get the service and care that they need?
And can you hear me?
Yeah.
Okay. So I think what needs to happen is, first off, sort of a presumptive eligibility for health insurance. And so many of, at least among the and I don't like the word either, migrant population come without having health insurance. So that is, and how you get into the hospital and get services and or a birth center is you need to be insured. So that's one of the main barriers to getting the kind of services that pregnant and postpartum women need, especially in the homeless population. And then the next intervention is housing, because being homeless puts a large degree of stress on the pregnancy. And so these women are often at risk for delivering preterm babies, low birth weight babies. Many of them come and are anemic, vitamin D deficient, malnourished, and babies are small and not growing according to pregnancy timeline. So certainly improving anyway to get access to care is premier. I think also as we talk about housing, it's been difficult to talk about housing among this population because this population is regarded as other.
Mm.
And what I mean by that is you hear it across the media. They're referred to as criminals. Nobody really wants a shelter or a in their community because it brings a certain population that come with quote unquote chaos and drama. And so we have to really be thinking about how do we reframe how we talk about and include this population who are members of humanity. And why not think about how to integrate into the communities the way that we've thought about the birth center, which is we wanted it in Roxbury, but we still had a zoning issue because the folks on the street that we would like to put the birth center said that they wanted low-income housing, and they didn't really see a need for a birth center. So
I think you raised what's an interesting challenge of what happens and how do we deal with the not in my backyard syndrome that goes on. Yes, I see the problem, but I don't want the solution to be near me. And we also see a dynamic of pitting oppressed people against oppressed people. And that's happening at global levels, it's happening at local levels, it's happening all over. And we're seeing now the pitting of migrants against children in health centers or community centers. And so this tension is never looking at where there's plenty of space. And we see that with LGBT youth and LGBT people in general, where the attacks are happening. So Connor, as we really begin to think about populations that are historically disenfranchised and not supported, how does this issue show up, and what are some of the ways in which you see responses needing to be developed?
Great question. So with the population I work with, which is again 18 to 24-year-olds experiencing homelessness, so many of the students on the call tonight are probably actually in that age range. I actually just aged out of that range. I'm 25 now, but
I remember that. I remember that. That was 100 years ago. Thank you for the reminder.
But this age range in particular is one of the age cohorts of people experiencing homelessness that is most disproportionately people of color, that's most disproportionately LGBTQ plus individuals. At Breaktime, 87% of the young adults that we supported last year, or we call them our associates, 87% of our associates were non-white / people of color. 87%, which is just wild. Like that number in terms of a percentage of individuals experiencing homelessness that are people of color is highest in the 18 to 24 demographic, according to some research done by the National Coalition to End Homelessness. And the same thing goes for LGBTQ plus individuals. Again, I mentioned the stat from the True Colors Fund that 40% of individuals between the ages of 18 to 24 experiencing homelessness are LGBTQ plus. At Breaktime, that number is closer to 33 to 35. But still, that should be shocking to you. And it actually is above and beyond sort of what we see with other issues that are also having a disproportionate impact along racial lines or along lines of sexuality and gender identity. And so this is one of the reasons why I'm so passionate about solving young adult homelessness, because these young people, who again are the same age of many of the students on the call, are at this point in their life where they're entering the workforce or they want to be in college or post-secondary education. They're still figuring themselves out. I came out when I was 19. They're going through that process of self-discovery, yet they do not have the basic stability they need to be able to live their best life and go through all that transformation. And especially with how cost of living has skyrocketed, you think about yourself, and many of you might be at this age, 18, 19, 20, being fully financially self-sufficient is almost impossible unless you've been saving your whole life and working since you were like 10 years old. And so for a lot of our young people, who again are disproportionately people of color and disproportionately LGBTQ+, they're entering young adulthood with this massive challenge of housing insecurity. And the reason it's so important to address it then is because the longer an individual experiences homelessness, their likelihood of chronic homelessness is going to shoot up. One study here in Massachusetts actually reported that the number of every single day an individual is on the streets or unsheltered, their likelihood of chronic homelessness increases by 2%. And we have many young people who are experiencing different forms of homelessness for years. And so the likelihood that in their adulthood, this will become a prolonged issue is very high. And so I think that just raises the sense of urgency and importance of addressing this particular issue, given its disproportionate impact on populations that are already disproportionately impacted by so many social inequities, but also the opportunity to prevent longer-term homelessness, chronic homelessness, elder homelessness, family homelessness, and support that work as well through addressing this issue. And so the reason at Breaktime we focus on job and financial security is a lot of our young people, if they have the right amount of savings, if they have the credit score they need when applying for housing, they have a steady stream of income, they can enter into a longer term life of housing security. But without those things, even if they have different supports, it's just never going to be a sustainable long-term reality. And we hope to support our associates in eventually being able to be more self-sufficient. That's their dream, that's their goal, that's what they want. But if they don't have support in getting that financial safety net and getting the job security they need, then it's never going to happen.
So you raised several interesting points in your comments. One is the longitudinal nature of homelessness and its impact on people across the lifespan that I've just been sitting here thinking about. You know, the numbers of kids we know who are in Boston public schools who are homeless, who are showing up at school every day, but they are homeless. And then looking at generationally, the impact of that on them across their lifespan. How do you get the FICO score? How do you get savings? How do you begin to be able to develop credit in your name where credit has gotten more complicated? So all of the things, what do you hop? All of the hurdles, I knew I would get there. All of the hurdles that you have to hop are really extraordinary. And there's not the family to fall back on for so many of these young people who have also, many of whom have been put out by family, or whose family is in a position that they're barely making it as well. So poverty is another important part of this. So what all of you have talked about is really, Paul Farmer talks about a model of looking at structural violence and the ways in which systems are set up that act in a way that don't afford people access to the basic things that they need. If we think about Maslow's hierarchy of needs, the access to shelter is primary amongst those. Knowing that you have a place that you can call your own in some way is one of the most important baseline needs that we have. And I just wonder, how did we get here? Because this is structural. So this has been created. So how did we get here? What are we doing now that we're here and we're looking at this whole conversation, as Joanna, you mentioned, of the language that's being used to talk about the unhoused, and migrants are unhoused, and what's the right terminology? I hate the term migrants. And then what do we need to do to get ourselves out of this? And I open that up because it's really a question that I think is so important because it gets overwhelming if we try to look at it as one big thing. So what are the partializations that we need to do to move this topic? And I'm wondering if anyone has a thought. Luke, what does the data tell us?
I'm trying to think of where to go. I mean, mostly the questions you're asking, the direction you're pointing this feels like the right one. I mean, the broadest, context for this is to remind ourselves that we are in a region that is among the richest regions in the United States, that is among, the wealthiest country in the history of the world. So if there's a part of the world at any point in time that ought to be able to, safely, decent, provide safe, decent, accessible housing for everyone who wants to live here, it ought to be us. And we're clearly failing on that front. So it's not an answer. It's just another way to think about how shameful it is that we haven't lived up to what we ought to be able to do as a region, as a community.
But what you're naming is really important. What you're naming is we have the capacity and potential to do this. What's missing, it seems, is the will and the incentive. And as part of this, the issue of what happens when you have, venture capitalists are now speculating in real estate and buying houses, flipping them, and doing all that reduces the access to the housing stock that's out there. So is that part of the capitalist system? And is there a place where they are doing it differently? Does anyone know of a model where this is working differently, better? Kelly, are you aware?
I mean, I think sometimes people talk about, Nordic countries and what they're doing. But, within the US, I think that Massachusetts historically has been a model because we're not just relying on for-profit developers and private landlords to meet housing needs, that we've created state-funded programs to provide direct subsidies to develop long-term affordable housing. But as I was saying earlier, just these resources aren't to scale, that we haven't made the investments both to maintain existing housing units that are deeply affordable and to bring on new units to scale that's needed. And that how do we, some of the conversations are how do we reignite that desire to actually meet the unmet needs that we're seeing in communities all across the Commonwealth. And some of it is making sure that there is a buy-in from community members and political leaders that housing is a human right, and that whether someone is a longer-term Massachusetts resident or a newly arrived immigrant family or individual, that they're here now, and we have to meet each other's housing needs, and that's becoming, I'd say, more challenging, in particular over the past few months. So, I mentioned earlier how the state hit this self-imposed cap of 7,500 families, and so we're not honoring the right to shelter for families above that cap right now. We've created a waiting list that as of yesterday, there were 694 families on the waiting list. Some of them are in short-term overflow spaces. Some of them are just overnight and they have to leave at 6 a.m. Other families are staying at the airport or staying in hospital emergency rooms, staying in cars. And these are issues that have impacted unaccompanied adults, unaccompanied youth, and other populations, because we haven't had a right to shelter for those populations. But we're really seeing just across the spectrum more and more people experiencing unsheltered homelessness. And, there was the mention earlier of some of the point in time counts. The reason that Massachusetts had low rates of unsheltered homelessness was because we were adding on hotel rooms, bringing on dorms to be able to provide shelter. And now the state has said we've maxed out. And so some of it is an arbitrary cap. And so having those conversations, like, really, couldn't we keep adding a little bit more while we're building up the infrastructure to bring the homelessness prevention and long-term housing resources to scale? I think that, Massachusetts right now at the state level, they're looking at Congress to be able to provide some supports. And that's, probably a losing route, but also looking to the healthcare system. Can we maximize funds that are coming through our Mass Health program to provide housing supports and housing resources, to get waivers from the federal government so that we can recognize that housing meets public health needs. It really is medicine. And so I think that there are ways that the state is looking, how can we maximize resources to address housing issues? But at the same time, there's a reluctance because there's a perception that if we continue to meet everyone's housing needs, which we clearly haven't done, then it will be a magnet for additional people to come to Massachusetts. So, really having
Go ahead. I'm sorry. But that goes into what you know and learned as in social work school and other people heard. It's the Puritan poor laws, that somehow you don't want the poor to be too comfortable because then they stay poor. And so you really want things to be in a way that makes it uncomfortable. So you disincentivize them from being in positions where the belief is that they will take advantage of the system. And so that is so deeply embedded in our system, and it influences how policies get made, the ways in which people think about the poor, and that cuts across party lines. It is interesting to listen to progressive not be so progressive when it comes to who might end up being their neighbor or living down the street from them. Dr. King was right about in some ways, I'm going to label it the convenience of the liberal. It's great if it's over there, but not here. There's an interesting piece I'm putting in the chat. Amy Sokolow, who I spoke to this week at WBUR, did a piece on primary care-based housing program, reduced outpatient visits. So that there's a study that looks at if you do a housing program inside of that's at a hospital, this is Boston Medical Center, that it reduces the need, fewer referrals for social work, fewer referrals for emergency. It reduces the need for other kinds of services that are there that often focus on housing. And it's an interesting study and way to think about what happens when we begin addressing the issue where we immediately see it. When you're coming in to get your primary care, some of the work that's going on at Children's, for example, looking at young folks there and really beginning to think about interventions around homelessness in those primary care centers becomes so important. But I'm just wondering about other solutions. Joanna, any thought?
Well, rebuilding the healthcare and public health workforce. Certainly post-COVID, many healthcare providers, either in public health or in clinical practice, have left the profession. So, and that includes social workers and mental health workers, physicians. So there is work to be done there to rebuild the workforce. And then after rebuilding the workforce, to take care of those of us who are still in the workforce. It's very, very difficult to drive past Melnia Cass every day on my way to work. I have to be very, very careful of what I'm doing over there. You don't want to hit anybody who is in a wheelchair or cane. There have been many accidents over there. And so that takes an emotional toll on me. So as I park my car and now enter into this other world, if you will. So there are some workforce issues that need to be done. And what I'm hearing, and what I've been hearing, for years, is how very, very complicated this issue has become, and therefore the strategies are complicated.
So I wonder, as we're thinking about this, and Luke, I would welcome your thoughts on it. As you're looking at the research and the data gathering that you do at Boston Indicators and the way in which it influences policymakers and decision makers, how do you see a scaffolding of these issues that can become a narrative that helps people to begin to think about new models of intervening that reduces the that can help mitigate risk at a macro meso level, if that makes sense.
I think so. Yeah. I mean, one thought across all this is I hope that data and research is really important for contributing to a theory of change. But I don't think for a second that it's the most important part. You know, it's one piece of what we need. So that's just that thought. But I think, let me give an example of an observation I've seen across some of the research we've done over the last couple of years that, it's like one of those things, the more you notice it once, you notice a second time, and then you just can't stop noticing it. And this is the structural problem of dividing governance in Massachusetts across 351 separate cities and towns. It's makes it really hard to advance, bigger, equitable solutions that combat, I think, the, really human urge to be pretty small c conservative and resist any change in your backyard. And so I think it was Kelly who earlier mentioned in passing just the challenges, and maybe it's been mentioned a couple times, of placing recent migrant arrivals in certain communities. And that is so hard to do when you create all these hyperlocal micro governments who have a chance to say no. And so from a structural perspective, I do think one of the reasons why other developed countries, especially the Nordic countries, are able to do, so much greater social welfare provision is they are making these decisions at a national level. And the hyperlocal approach, it often intuitively feels better to advocates because it feels more grassroots and democratic to have local neighborhood councils and local city councils making these decisions. But I think increasingly we're seeing, and Massachusetts is a state that has among the smallest divisions of municipal governments. And it makes it really hard to equitably distribute homeless shelters and, place, like we're seeing in the last year, migrant arrivals in hotels and motels. And I think on zoning issues, right, the whole sort of history of zoning as a tool of exclusion is because we've let the Winchesters, the Sudbury, the S's, the Sudburys, act as these little fiefdoms. And I think it's been a big problem for us. And so that's a theme that emerges from the research when you see it across projects over time.
So it speaks to, and I open this up to everybody here, it speaks to a need to help people to understand what's in it for them. I do believe in narcissistic investment, that people do things because they see how it impacts them. And there are times at which people look at, oh, I'd never end up living under a bridge, or I would never be this or that. And I recently talking to a friend of mine who was in a relationship that she thought would last forever, and it didn't. And in effect ended up unhoused, needing to figure out for lots of reasons where she could go, what she could do, was couch surfing for a while, was surprised, was not prepared financially that this was coming. So all of those things that she had never gotten that could happen to other people happened to her. And it kind of changed her way of being. I would hope that people don't have to suffer to become empathetic. But sometimes it's not me makes it easier to not see and not respond to things. And I'm wondering, Connor, as you look at this as we look now at the lack of respect, caring that's going on around the country for LGBT youth, particularly trans youth in general, and particularly trans women, the impact on the sense of hopelessness, how it gets fed by the rhetoric. I'm just wondering how you're seeing this play out in terms of helping people to get the things they need to be able to say, I want to invest in my life, right?
Yeah, well, first on your comment around sort of what's in it for me, I think one of the most compelling statistics that I share with government officials, but that also should be appealing to the average taxpayer, is that the National Alliance to End Homelessness did this study in 2017 that a chronically homeless person costs the taxpayer an average of $35,578 per year, so over $35,000. And the study showed that costs on average are reduced by about 50% when those individuals are placed in supportive housing. Um, and for young adults experiencing homelessness, our experience at Breaktime is that if we're able to get folks onto a stable path, that ideally they never experience chronic homelessness. And so if you took that $35,000 a year per person that the government has to spend on individuals experiencing chronic homelessness, and if you forecast that over a lifetime accounting for inflation, that's almost $2 million
Wow.
in the average, based on the average life expectancy of an individual experiencing chronic homelessness. And so the highest users of our healthcare system, the highest users of various systems, are those who we've neglected and let stay homeless for all this time. And it's actually costing us more money than if we
House them.
took
Right.
any tried and true solution, including supportive housing, to address it. And I see it particularly for young adults. We're sort of at this pivotal turning point in their life where if we don't give them the right support, including workforce development, financial security, housing, mental health care support, all the support they need, if we don't heavily invest in them right now,
Right.
then it's going to lead. So from the taxpayer perspective, it's going to lead to a much more significant tax burden on the individual over time. And so I like to share that because I find it to be a motivator to government officials who are bogged down with a million different funding requests, and to individuals who want to understand from that sort of more narcissistic perspective how investing in this issue helps them. I'll also add that from sort of looping back to your last question around policy solutions, I believe that the fundamental thing that we lack in our state sometimes that most leads to us not being able to solve problems is coordination and collaboration. I've been really encouraged though by some progress that's happened. I'll give the example of the Executive Office of Labor and Workforce Development in the state of Massachusetts. They have been one of the offices that is most actively engaged in supporting on getting new arrivals or migrants into getting them work authorization, getting them into the workforce. And we've actually worked together on that. And it's been really encouraging because I see homelessness as an intersectional issue with basically every other issue. At Breaktime, we particularly see it from a workforce development and financial security lens. And so we work really closely with the state's Executive Office of Labor and Workforce Development. But traditionally, when you think of labor and workforce development, traditionally their focus has not been on solving young adult homelessness,
Right.
but they can and should have a big impact there. So I'm starting to see some more cross-agency collaboration in between organizations. It's incumbent upon us to work together. And at Breaktime, one of our core values is collaborative innovation. This idea that we work together to create transformative change instead of reinventing the wheel or working in silos. And the reason that our program model is so specific, job and financial security for young adults ages 18 to 24 experiencing housing insecurity, is because that was the gap that I saw when working at a youth shelter, talking to all the partners. And so I think it's really important that we be just incredibly collaborative as much as we possibly can. And that includes the government working together to ensure that different agencies, which are sort of siloed and have these different mandates and responsibilities, see cross-sectional issues like homelessness as a shared responsibility and not just a Executive Office of Health and Human Services.
Yeah. That's what I was going to say is traditionally Breaktime would be EOHS, and that would be where it would naturally go. It would not, one would think about making an alliance in the area that you're in. And but it makes sense when we think outside of the box. And so, so Simmons, as the only women-centered institution, university in the city of Boston, what can we do? We want not to only do this kind of academic, but what role should institutions like Simmons University be playing in solution-focused work in this area and in this part of Boston? Tell us how we can be part of the solution. What do you see as a role for Simmons in helping to, the late Larry Kessler, God rest his soul, who passed away last week, one of the great heroes. If you don't know Larry Kessler, look him up, the founder of the AIDS Action Committee, a real hero, used to say that his vision was to make sure that he helped find the cure for the epidemic for AIDS, so he could lock the doors and turn off the lights. And he got up every day thinking, what do I need to do today to lock the doors and turn off the lights around this pandemic? What do we need to do as an institution to help lock the doors and turn off the lights on this issue that surrounds us? Thoughts, reactions. And we're strong. We can take it.
I'll say one really quick thought is just to advance structural solutions. I think among the best ways to do that is to run for office, to do it through government, to organize, to win power through elections. And so one idea is, and I'm sure there are ways this is absolutely happening at Simmons, but is to work to support young women to consider engaging in electoral politics and running and winning for office.
We are so indebted to Barbara Lee and the Barbara Lee scholars who have been helping us and her work in getting women elected to office across the country. So it's just been so important to have that support to expose young women and people who identify as women to the opportunities to run, win, and then govern differently. It's not to ape the model that hasn't been working, but to create the model that you want to see that can make change. Great. Other thoughts? What else might we do? Connor?
Oh, yeah, I would add that. I love that, Luke. And I would add that working in the nonprofit sector and working at organizations like the ones that we're a part of is one incredible way that you can be a direct agent of change. Getting to go to college is such a privilege that unfortunately the vast majority of people are not able to have access to. And so all that you're learning at this incredible institution and all that you're taking from that, if you can bring those skills to organizations like Breaktime, organizations like the Mass Coalition for the Homeless, you can have such a transformative impact at our organizations and ultimately in the sector. I'm proud of the fact that Breaktime and many other organizations have worked really hard to make our salaries much more competitive. We now offer a minimum salary of $60,000, and that's before all of the benefits we offer. And there's been a lot of work and a lot of funding to help continue to create more competitive jobs in the nonprofit sector. But at the end of the day, if you can take all this skill and privilege that you've gained from your experience at Simmons and bring it to a workplace that could really use that for social good, I think that's one way that you can have such a transformative impact. And so from the university perspective, supporting, encouraging students to go down that path is one thing. And I'll share from my personal experience that, when Breaktime at the beginning wasn't able to pay me, Harvard University, once I graduated, provided a small fellowship for me that funded me to work at Breaktime because we couldn't afford to pay me at the time. And that's what allowed me to work when I graduated in 2020 to work that year and launch Breaktime. It was a year of transformative growth. We went from, $100,000 budget to $2 million budget in a year, and we launched and have been better. Exist basically because of that. So I think if Simmons can not only help support students in going down the path into impactful jobs, such as those in the nonprofit and public sector, but also actually put dollars behind it and invest in helping organizations like Breaktime and like the others on the call, and making sure we can bring people into this world, and make it an economic reality for them. I think that's one huge way that the university and its students could help us to end issues of homelessness and housing and affordability.
Great. Thank you for that, Connor. Joanna?
Yeah, I would say the offering of fellowships and internships to the students, especially since our focus right now for this population is healthcare utilization. You have the School of Health and Science there at Simmons, formerly the School of Nursing that I graduated from. But having those kinds of opportunities for students to really step in, peel back the onion skin, and get into this type of work.
Right. Okay. Kelly, any advice?
Yeah, I think in addition to what my co-panelists have already discussed, really being engaged with decision makers. So a lot of our work is at the State House, talking to state representatives, state senators, sharing your expertise, the work that you're doing, your own lived experiences, sharing what you're seeing as solutions, what you're hearing from the families and individuals and youth that you're working with. That really makes a difference. Sometimes it can be just a few constituents who are well informed that can really change the trajectory for a legislator and to get them to understand. I know, we worked for many years to push the state to have infrastructure around youth and young adult homelessness because it was just, scattered federal funding, and having young people with lived experience of homelessness, as well as social workers working with those young people, come with us to the State House and sitting down with key legislators and their staff and sharing the insights and where the gaps are. Like Connor talked about, like, we're seeing these gaps, but we can fill them. And that really makes a world of difference. But also, especially at this time when there's so much division and myths and stereotypes and hateful language that's being thrown around people experiencing housing instability and homelessness, to have people who are compassionate, who are focused on social justice, really being engaged at the ballot box, but also in the halls of the State House. We have our Legislative Action Day coming up on March 7th. I'll try to stick a link in the chat, but we would
We're
love to have.
participating. Yeah, the school social workers participating.
Perfect. Wonderful.
Yeah. I mean, so those are the sort of things. And I'm also, Luke, looking at you thinking about the Boston Indicators and philanthropy, of getting folks into those spaces as well. I think it's the not-for-profit sector benefits greatly, but we also, I believe, need to be on that other side of the equation, on that for-profit side where decisions are getting made, where also you can begin to influence, if you will, some of the ways in which decisions get made, but particularly around corporate philanthropy and their focus on certain issues. So is that really thinking about the role of philanthropy in places like the Boston Foundation, the Boston Indicators, and thinking about Simmons, what might we be doing?
I like all that you said. On my end, I'm not part of the grant making side at the Boston Foundation, but I really appreciate you noting the different places to engage with philanthropy.
Yeah, and so it's not always about the giving, but it's also about really thinking about what are we going to do the research. And the Boston Foundation is unique because it is both on the philanthropic and it's also looking at the data and charting really important courses. The piece on wealth is probably one of the most important pieces that they did. And I believe they're working on another study post that 2015 study. So those are important pieces to play as well. We have tons of questions. We're not going to get to all the Q&A. I think you all have been seeing it, people responding. Targeted questions. I know that there was people really wanting to think outside of the box in terms of how do we pull back. Anna has been asking, how do we encourage biotech companies to increase remote jobs? She's talked about year-long Airbnbs are extremely unaffordable. Hostels are fully booked. If people lose their housing due to domestic violence or just couples arguing with each other or they can't find affordable housing, where do they stay? Great question. Airbnbs is not necessarily for everybody a response. There was another question here about any special programs of supports for homeless individuals with physical or intellectual disabilities, cognitive delays, blindness. This is an exceptionally vulnerable population. Anyone have a response to that? Are there special programs for homeless individuals who have physical or cognitive disabilities?
So I can note that there's one state-funded housing program called the Alternative Housing Voucher Program, AHVP, that's targeted to individuals who are under the age of 60 who are have disabilities, who are experiencing housing instability and homelessness. And this is a program that we are seeing some really important growth in terms of funding over the past few years, and also working to make sure that the subsidies actually help people find units that are available on the market. Oftentimes the housing subsidy programs, the amount that they offer is too low to actually make that bridge between what someone's income is and what the market rate rent is. And some important changes have been made to deepen the value of the subsidy, and also to make sure that the moving costs are covered, to look at small area fair market rents instead of just a larger what the rents are in a broader area, to really make sure that the subsidies meet the needs, and that this is something that is not to scale yet, but that thousands of individuals in Massachusetts have been able to participate in. Unfortunately, the waiting lists are long, but it is a targeted program that has really great success for the individuals who are able to enroll.
Right. And then, Luke, there was a question here, not exactly a question on homelessness, they said, but a question on housing. Is any work being done on the effectiveness of affordable housing programs when it comes to lottery participants who live in rented housing? Specifically, I'm curious about people who obtain affordable units through lotteries and then have to break their current lease and deal with the negative financial consequences of that, which can create further financial burdens and exacerbate financial insecurity as it relates to housing too. Unfortunately, I've not seen many resources related to this aspect of affordable housing, and curious if this issue comes up commonly. Thank you. It seems a very boutique area in some ways. I don't know if anyone is familiar with dislocation, relocation, and the cost burden. So does this sound, any thoughts on this question?
Well, I think I'm only partially tracking the question itself. I'm not familiar immediately with research on that. I'll share. I think this is not what they're getting at, but I do know that the Boston Housing Authority has been, over the last couple of years, part of a new effort to help tenants with Section 8 mobile vouchers get better information about the range of communities they might be able to consider using those vouchers in. So I know that there's a good deal of research looking at location decisions of where people are using their vouchers and trying to help residents make better informed choices, but I don't know that's exactly what this is getting at.
Yeah, and it seems also to be a question about the cost inherent to, in some ways, stepping into something that's more affordable, where you are needing to let go of something that is still going to cost you. So you have to buy out your lease in order to get out of the job. The other piece now is we're hearing in NPR just did a piece about tenants where they're getting 6-month leases now, so that they can raise rents, so that which is very different, so that people are they're so desperate for the housing that people are taking a 6-month lease, and then the lease gets, the rent goes up within 6 months, and it keeps going up every 6 months. And that's a new model that's occurring, and something that we really as advocates need to be aware of and study. The other piece is we need we need infrastructure change. We also need a transportation system, a public transportation system that works, because what we are finding is the last few months in this state has been really hard for people when you can't depend on needing to get where you are, particularly if you've had to move further and further away from where you need to live to be able to get back and forth to work. So that's a major piece as well. We are at time, and I wanted to take this moment to thank all of you for helping us kick off our commitment to being a part of the solution to an issue that is in some ways biblical in its proportion, but one that I think we have to look at in increments and not get overwhelmed by the scope. That we are positioned. Simmons School of Social Work, this is our 120th year. We were founded in 1904, and we were founded to deal with issues of poverty, homelessness, lack of access to healthcare, lack of access to healthy air, water, milk, food, all of those things. So we were part of the beginning of the progressive era and really looking at the problems being the same. So we know what we need to do because we've done it before, which is to be able to not become overwhelmed by what we're seeing and to understand that we can really begin to chip away at these issues if what we can do is begin to get people to believe that this is in all of our best interest, to want people to be housed, to want people to be safe, to want people to feel secure from zero to end of life. And so I appreciate you being able to be with us today in this conversation, and look forward to keeping you abreast of what we're doing and hope to invite you back later on. Thank you all very much.
Thank you.
Thank you.
Thanks a lot.
And thank you, everybody, for participating. There should be, we'll look at the questions and the comments and be able to, this will help to inform what Meghan and I think about what's next. And again, Simmons could not be more grateful. So thank you, thank you, thank you. Good night, everybody.